Good morning, everybody. Myself, Dr. Niraj from Dr. Jain Skin and Hair Care Clinic, Kolkata. I want to share a few ideas regarding the hair transplant. There are a lot of clinics in all over India, even all over the world, where the transplant is going on. So before going to the transplant, I just request to the patient, don't go for the clinic, see the doctor who is going to do your transplant. So always ask regarding the doctor who is going to do your transplant, because it's important. The clinic is not going to do the transplant, the doctor itself is going to do your transplant, because there are a lot of clinics only the doctor doesn't do anything, only the technician does it, even the non-doctor does the transplant. Okay, now I am coming regarding the safety of the transplant, because a lot of patients used to say, sir, safe hai ya nahi. See, it's entirely safe. It's going on since 1950, so we have a long history where transplant is going on, because there are a lot of rumors regarding this. It causes brain tumor, cancer, and these things. See, it's completely a myth. But I have never seen a patient who got a tumor or cancer or something like this after the transplant. Now, should I go for FUE versus FUT? FUT is the old procedure, while the FUE is the new advanced procedure. The result will be the same, but the thing is that in the FUE your morbidity will be less. Morbidity means, see, if you have a long cut like this, since in the FUT we have to cut a large area, then we transect the grafts from there, separate the grafts from there, and then we implant it. In the FUE we just take a instrument like this pen and we just extract one by one. So what happens? So there will be a small hole like this, which will get healed within 2 to 3 days. In FUT, while it takes longer time, so the chances of pain will be more and the infection will be more. While the FUE, the healing will be early, so you can recover early. Now coming to the pain part, doctor साहब pain कितना होगा? See, the pain, there are a lot of clinics who are marketing no pain, no scarring, something like that. See, during the time of anesthesia, you will get a little bit of pain while administrating the anesthesia, maximum 5 to 10 minutes in the entire procedure of 6 hours to 8 hours. So it is not painful. Just while administering the anesthesia you will get a pain. After that it is not painful. Scarring, see, wherever the hairs have been removed, there will be a small amount of punch type of a scar, which size is very much less, which is not visible even if you keep a hair like this. Now coming to the side effects of the transplant. The patient asks side effects क्या है? So there isn't any side effect of the transplant. There will be little bit of swelling we see in about 25% of the cases after the transplant, which remain maximum for 5 to 7 days. So recovery is very early. So you can resume your activities within 5 to 7 days max to max. Your office works also. Now the patient used to ask how much graft I need. So it totally depends on the grade of baldness you have. Grade 3, grade 4, grade 5, every grade has a different number of grafts. Now there are different clinics who used to say the different terms to the patient, so the patients get confused. Some of the clinics used to say grafts, some say follicles, some say hair. So one graft is equal to, in India it is said, 2 to 2.5 hairs. And coming to the follicles, like example, if you have 4 root graft, a graft containing 4 roots or graft containing 3 roots, if you cut it longitudinally in this way, so it becomes 2 follicles, but it was 1 graft. So one graft can contain 2 follicles, one graft can contain 1 follicle. It depends on the total number of roots it has. So ideally we say if you have 3000 grafts, it can be up to 4000 or 4500 follicles. It totally depends on the quality of the graft you have. So ideally it should be, patient should ask how much grafts you are going to implant. Now coming to the cost of the transplant varies in different clinics. It can go low down up to 15 something like that, or even less, and go up beyond up to 100 or even more. So the cost varies in different clinics. Now the most important thing in the transplant is how you are placing the design, how you are placing the angulation while implanting the graft. So the technique is very much important. So the doctor who is doing it, it's very much important to know about it, how he is going to place it, how he is going to do the marking, how he is going to put the angle and the direction of the grafts. Otherwise it looks a bit artificial. So now coming to the time, ideally in our clinic, if we are planning to do 3000 grafts, so it means it will take at least 6 to 8 hours to complete that 3000 grafts. Now new terms are coming out like bio FUE and something like that, advanced FUE and something. So these are nothing but the new terms. Some of the clinics are adding PRP with the transplant, which gives a better result to the transplant. So you can try that also. Now coming to the longevity of the transplant, कि डॉक्टर साहब कितना साल तक रहेगा. See, it totally depends on the doctor who is doing it. So how he is placing the grafts and these things, and how you are caring for it. So the medicines are most important. So please don't stop the medicines without informing the doctor. So continue the meds. Don't smoke. It will give you a very good result, and it will keep the result as much as you are under the observation of a doctor. Now coming to the donor area also. So ग्राफ कहाँ से निकालेंगे? So we extract the grafts from here, from your back, from the sides, from your beard, from your chest, and the rest of the body hairs according to the need of the transplant or according to the need of your recipient area. So most important message is go for a doctor who is going to do your transplant, because it is very much important. Pain is not such, just maximum 5 minutes. Grafts are important. Don't ask hair, follicle, this thing. Just ask how much graft you are going to implant, and it takes time, about 6 to 8 hours. It is not done in 2 or 3 hours. Thank you. And it takes 6 to 8 months to get a result. So you have to wait for 6 months to see the result. Don't panic. Thank you.